Hi there, I'm Shauna Deru, and welcome to the Ultimate Perimenopause podcast. Today I'm here with Maggie. Welcome.
Hi.
And we're talking with an amazing physiotherapist, Nabila, here, and with a focus on pelvic health physiotherapy. Welcome, Nabila. Can you tell us a little bit about your work, your practice, and how you got interested in pelvic physiotherapy?
Sure. Thank you, Shauna and Maggie, for having me on today. I really appreciate it. This is a great way to get the world of pelvic physio going. So in terms of my work, I'm an orthopedic physiotherapist. And recently I have been certified to perform pelvic health physio as well. So in terms of pelvic health physio, I have been I've been assessing and treating patients with anywhere from stress and urinary incontinence, working with a lot of women in their prenatal stages as well as postpartum. I'm loving it, absolutely loving it, working to expand that practice, especially with all the pregnant mamas around. And the reason I actually got interested in this type of physio was during my time as an orthopedic physiotherapist, I was actually really interested in chronic low back pain and hip pain and why it was so prevalent in the demographic and why there wasn't anything that was really just working for people and why that back pain was still so much apparent. And I did some research into courses that I could take as continuing education, and I came across Pelvic Health Solutions, which is a great organization that focuses on pelvic health physiotherapy, and didn't know what I was getting into, have to be honest. And I'll probably talk a little bit more about what we do in our sessions, but I've actually came across amazing techniques that have benefited those patients that were suffering with that chronic low back and hip pain, and then being introduced to the women that are pregnant has just been amazing, and I've absolutely loved it.
Yeah, it's not a field that I certainly didn't know anything about this field until about a year ago.
Mm-hmm.
And I was like, okay, what are we talking about here? And at that point, I was 48. A year ago. I didn't think by then, senior moment. Because it has just never been in my wheelhouse that this existed. I've had 2 children. Even after that, nothing was said. There was no rehabilitation, nothing. So this is a fascinating subject.
Mm-hmm. So yeah, I really wanted to bring Nabila on to talk about some of the things that really bother us in perimenopause and especially at menopause. So, let's sort of dive right into it. So things like urinary incontinence and painful sex and prolapse. And I just think that people aren't aware that there are solutions for these things. And, I speak with women every day who are, whose hormones are shifting and their estrogen drops, and they just assume that that the leaking when they jump and run is a normal thing. And, it's like, this is sort of like a good public education time here of, let's talk about what our solutions and options are, because these aren't things that we just have to put up with.
Yeah, this is sort of our public service announcement for the month.
Exactly.
And it's well overdue, so it's great.
I know. So, let's dive into the first one. So urinary incontinence. So for a lot of women, it might just be mild. It might happen just if they have a really bad cough or if they're sneezing. I always joke that the best place to put a pelvic physiotherapist is at a trampoline park. So, get the
true.
Yeah. The moms who are coming off the trampoline who just thought it would be fun going, oh my God, what's happening?
Yeah.
Because it's something that we don't realize that maybe, after having children, our pelvic floor hasn't healed properly, or we don't have the muscular strength that we used to. And sometimes it takes a stress like that to actually notice it. So from your perspective as a physiotherapist, what's going on?
Definitely. So the amount of times I have women in perimenopausal that come into my office and say, I thought this was normal, but then someone told me I can fix it. So yes, you can. It's definitely something that we can work with. as we know, with normal aging process, muscle mass tends to decrease. And for us to maintain our muscle mass, we actually have to actively engage these muscles and work with them. And our pelvic floor is no different. So we have to make sure that those specific muscles are strong enough to sustain things like jumping on a trampoline or running. So what's essentially happening with urinary incontinence is that the pelvic floor is not strong enough to support the organs around there. That includes the uterus, the bladder, the rectum as well. So everything is sort of hanging on by that pelvic floor. So as you can imagine, if that pelvic floor is not strong, things will start kind of sort of shifting out of place, putting pressure on them. And so for urinary incontinence in particular, when there's no pelvic floor, the bladder essentially doesn't have its control when it has to, avoid that leakage from happening. So essentially what we get is either a wet underwear or some sort of leakage after any sort of activity that might provoke that movement.
So does this only happen to women who've had children? So, I get that that's more stress in it, so there's some recovery there, but is this something that happens to a lot of women with a certain age?
Definitely. So just like you said, childbirth does have an effect on our pelvic floor. We need that time to heal. We need that time to sort of recuperate from that event. So it does leave some tissues damaged that we do need to essentially repair. But having said that, no, it doesn't only happen in women that have had children. Just like I was explaining the aging process before, those things do happen. And because of with perimenopausal and menopausal women, we have that decrease in estrogen, and that is a huge component to decreasing our flexibility and sort of our resiliency of our tissues. So that definitely has a huge impact on our pelvic floor.
So a couple of questions spring to my mind is that once you've had children and it's sort of, you don't feel anything, you don't see anything for a few years, can that happen? It can gradually build up to a point where then you start to feel the effects of that. Or would it normally, if it's going to happen, it would happen right away and you either just wouldn't notice it, or, what was the transition there?
So to be honest, everyone is individualized. So there are a few people that do feel it right after. And usually these, I've found that these sort of women have had some sort of incontinence prior to pregnancy or even during their pregnancy, but they just didn't do anything about it. So what happened was that or they just thought that it was normal during pregnancy, right? The increased frequency of urination. They're like, oh, I was just peeing a lot. It's, it's normal. But there was some aspect of incontinence there that had to do with their pelvic floor. So when they come see me after they've had their baby and they're having these issues, I think they realize that, oh, maybe this is what was going on while I was pregnant or even before I was pregnant. And then also there are those women that do tend to have it later on. And this may be due to the way they got back into activity, some of the activities that they are doing, that they're involved in. And a lot of times it's just a matter of they just don't have awareness around their pelvic floor and they just need that little reminder.
Yeah, awesome. And the other question I had was, you talk a lot about lowering of estrogen. Could it also be a dropping of progesterone? So, we know that in order for estrogen dominance to be estrogen dominant, it doesn't have to be super high. It just means your progesterone is lower than the estrogen. So can that also mean that your estrogen is either equal or lower, but your progesterone is even lower? So that could be a cause as well.
Definitely. Okay. And there has been lots of research done in regards to estrogen primarily. However, progesterone definitely does have an effect as well.
Mm-hmm. Cool. Thank you.
Yeah. So, I mean, I find it really encouraging that a lot of women, younger, like 20s and 30s, are knowing about pelvic physiotherapy and starting in their pregnancy and following through and being super proactive. But most women my age who I speak to have never heard of it, which, I guess it wasn't a thing.
No. I mean, maybe it's not because of what you just said, but I thought maybe it's a British thing. Maybe it's because, we don't talk about that, so nobody knows, but maybe it's just an age thing.
I think it is. Like I've been pretty connected in the health community for a long time, and I didn't know about this when I had my kids, and my youngest is 9. So I kind of find that a little surprising.
No, it's very true. And I have to say, my mom had no idea when I started telling her what type of patients that I work with, what I've been doing with them, where she's like, wow, I wish they had this when, I had you. So definitely, I think it's more of an awareness thing.
Can you explain exactly what the pelvic floor means? Because for some reason in my head, I'm thinking, when you have children, sometimes they do have to cut down there for whatever reason. Is that part of the pelvic floor?
You got it. So essentially the pelvic floor is a group of muscles. So it's not just not one muscle in particular. So it's a group of muscles that are located in the pelvis that give us that support for those organs, right? So essentially, in terms of the scarring or the tearing that happens, or even when unfortunately we have to get that episiotomy or anything like that, there is some tearing that occurs in the pelvic floor muscle itself. So any sort of trauma to those muscles, whether it's just from a vaginal birth, everything, no complications, or if there's some tearing, can affect your pelvic floor contractions and your pelvic floor activity in general. So that can always almost predispose you to problems such as incontinence or prolapse, for that matter.
Interesting. So, you would think that when you're in the hospital and you've had your children and you've had the episiotomy, potentially someone would come and give you some advice.
You would hope, right?
So, but Shauna, from what I'm gathering from you, that didn't happen. I had 2 children. That didn't happen. So there's obviously some disconnect there that people are, most people are falling through the cracks, it seems, which is really unfortunate when you could potentially heal it at a time when it needs it the most. And it goes so long that there's potentially more problems along the way.
And I think slowly it is becoming more prevalent and just more talked about within the health community. And I think that's huge and that's important. So I've had a fair amount of patients that have said that their OBGYN has said, go to pelvic floor physio, or their midwives are referring them, which is so great. Lots of word of mouth. So I think that just continuing that is definitely important.
Mm-hmm. Mm-hmm. So if you had your kids like 10, 15, 20 years ago, is it too late to start? Like, is it going to be a longer road? Is it harder to fix?
Not at all. Again, everyone's individualized, so it really depends on the compliance of their tissues, whether they had any complications with their birth or anything like that, but it's never too late. If you think about it, if you think about going to the gym, you haven't been in years, and is it too late to go? No, it's not. It's just a matter of making sure you're doing it right. And I think that's the reason why getting an assessment by pelvic floor physio would be a great source of advice. No bias, but
that would be my next question. Would be, because people could Google pelvic floor exercises, and there's probably 1,000,001 out there. Mm-hmm. That's not to say that they're all exactly what you should be doing. So what you're advocating is go and see a specialist, get that ball rolling, get some information from them, and then do their exercises and follow-ups.
You got it. Because I've actually had a few patients that have come in saying, I've been really good. I've been doing my Kegels. I've been doing my exercises. And, when we go in and assess, unfortunately, they haven't been doing them correctly. Or their pelvic floor is hypertonic, meaning that it's so tight that even though they've been working on their Kegels, it really hasn't been doing them any good. So it's just a matter of getting that assessment, knowing whether you should be working on your Kegels or whether you should be working on some more relaxation tools for your pelvic floor, and just knowing how to do it properly.
And what is your advice on somebody doing this for the first time? We were talking about this a couple of days ago, and I was saying, well, I had a procedure for fibroids, so I've had a transvaginal ultrasound, which to me was okay at that point. But then you sort of move into a pelvic exam that's really, you're really getting to know somebody at that point. So for some people, it can be very scary. So what would be your advice on potentially picking somebody that you could work with, and then the sort of mindset to go in with? Because, would you say it was an invasive procedure?
Well, I would say that it definitely has to, it really tests your comfort level with certain people. So yes. You definitely have to be comfortable with your physiotherapist. You have to be able to be open with them. You want to have that sense of just a good rapport and a sense of comfort in the room that you're having the assessment with. And I always tell patients the first day, if you're not comfortable today, that is okay. We can just kind of talk through it, and I will let you know exactly what we will be doing. And sometimes they're like, oh, no, I'm fine. I'm good. I've had 5 kids, just go for it kind of thing.
That does help.
Exactly. And I do have some patients that are a little nervous the first time, and that is okay. Mm-hmm. It's not a bad thing to come into a pelvic floor assessment and not want internal. That is, it's totally okay. And I usually have the first couple of sessions to be more of an educational component, because that itself is huge, especially because we've been talking about how the awareness around pelvic health physio is not really there. So just creating that comfortable environment for the patient is really, really important. And the patient should know that, even though we're sort of taking on this assessment, they're also guiding us, because they can let us know throughout the entire time what they're feeling, whether they want to stop, or if they're feeling any sort of sense of discomfort, and we'll completely respect that. So, yeah.
It's very comforting to know, because I've had experience with this too. And my experience was a very, pleasant one, because it wasn't, when you go and have a pap test, etc., you don't see the doctor. They're underneath, the cloth, or yeah. They're around that area.
In and out.
Yes. What's the correct term? It's not physician, or is it physician?
So for
you.
So pelvic floor physiotherapist.
Okay, so your physiotherapist, yes. She faced me the whole time.
You got it, exactly.
That made a huge difference, that she was connecting with me. She was feeling what was going on, but her whole focus was on me, and that made a huge difference. And that's the difference between an MD. Obviously, they're not going to be doing the pelvic floor exams, not this specialty anyway, but the difference in it, I was very surprised about and very comforted by. So that's obviously sort of the training that you go through. That's what I'm assuming.
Oh, definitely.
Yeah, that's what we do.
Definitely. Yeah.
Yeah. So that's very different for people who are thinking of doing it. There is the option to say no, which is always nice.
Of course, always. Yeah.
And then to know that, they're not going to just be staring at this part of your body. They actually be asking you questions and looking you in the eye, looking in your face, and actually having a conversation with you, which I found really good.
Yeah. I love that distinction. I hadn't really thought about it, actually.
When you're on the receiving end, you think about it. Yes.
Yeah. So let's talk about another big one. So many women in their 40s and 50s have changes in their sex life. So they might have more discomfort or dryness or outright pain. So is this something that the pelvic physiotherapy can help with as well?
Definitely. So we know that with the changes in the hormone levels, we obviously have that decrease of estrogen, which will affect sort of the acidity of the tissue. So that can bring upon dryness, itchiness, redness, and those can be obviously very discomforting. So we definitely work with this in terms of physiotherapy. So we talk lots about hydration and diet and things that do influence sort of the flexibility of tissues and maintaining that flexibility. And we also work on certain exercises just to kind of ease that tension that's been there for so long, and we can introduce different strategies to enable those tissues to become a little bit more flexible as we age and maintain that flexibility. With the discomfort, especially with intercourse, things like that, we work with dilators, and that I think that's a great adjunctive therapy that I use, that we can really help the patient feel more comfortable about getting back into intercourse if they've had that period of nothing going on, and if they are feeling any of this discomfort, we can talk about any sort of topical creams or anything that will help out. And a lot of times I refer to these guys. I know they can help out with that as well.
For those that are not watching on YouTube, it was to Shauna, the naturopath. Yeah, just in case they're listening, not watching.
Exactly.
Yeah. I mean, I address the hormonal component, obviously, but I just found that that's often not enough. So we often need to look at, the tension and the health, the muscular health, and all of that as well. Like sometimes the hormones alone don't do enough. But that is something that I do use quite often when women are struggling with like discomfort and pain with sex as well. Yeah. Because it's a big topic, and you don't want your physical body changes to be the big factor that's interfering with that part of your life. Obviously, there may be other issues going on with relationships and connection and that type of thing. But when physically we're starting to change, it can be really challenging. So it's good to put out there that there are some real practical solutions here too. Yeah. And then the last question I had was around prolapse. So this is something that I think a lot of women have mild uterine prolapse that they may not know about, that they just describe as, sort of downward pressure around their periods or otherwise. So I'd love to hear more about your take on that, and, what it is, if you could maybe explain what it is and how women typically experience it and what we can do to work on it.
Sure. So prolapse essentially is the dropping down or the bulging of any of the organs that surround the vagina into the vagina. So we do have mild, moderate, and severe, so different gradings of the prolapse. So usually what the patient may feel is some sort of, just like Shauna was explaining, just some sort of bulging or heaviness around the vagina when they're doing any sort of activity. We can actually, the nice thing about pelvic health physio is that we can actually assess for prolapse, and without sort of getting a full ultrasound, we may have sort of an idea whether there's a prolapse apparent or not. So in terms of the uterine prolapse, so that is the uterus sort of dropping down into the vaginal wall. So there could be a little bit of, there's almost like a weakness of the wall, so it's pressing on it. And then we also have a rectocele, which is the rectum kind of pushing on that posterior vaginal wall. And we also have the cystocele, so from the bladder. So the bladder is pushing on that wall. There are instances where people can have more than one prolapse, more than one organ prolapse. And just like I was explaining earlier, again, coming back to that pelvic floor and that support system that it gives, the pelvic floor actually helps maintain these organs and the walls of the vagina, essentially. So if we have weakness of the pelvic floor, you can imagine that there would be less integrity of those walls that would allow those organs to sort of press on and potentially bulge through. So coming to pelvic health physio would be a great idea if anyone is suffering from any of these symptoms, because we can both assess and we can treat. So really working on strengthening that pelvic floor, and progressing through treatment, making it more functional. That's a huge part of pelvic physio. We just don't work on you doing your Kegels. We work on you doing your Kegels throughout daily activities, because that's when we want the pelvic floor and the muscles to adapt to those certain movements. So with the prolapse, strengthening the pelvic floor is definitely a huge component to that.
Cool. So
now,
if we
that reminds me of something that, sorry, we had a little bit of a delay there. That reminds me of something that a friend of mine was talking about, and she was talking about, let's talk about a device that could be inserted, let's say, and the muscles would have to keep it there. What's your opinion on things like that?
Right. So there are lots of devices that are obviously out there that sort of help, get that pelvic floor a little bit more engaged and a little bit more recruited. The only thing is, obviously, if we already have a tight pelvic floor and we're working on our exercises or we're creating more tension, it's really not going to be beneficial. So, trying to find out whether, what the state of your pelvic floor is important first. Having those devices inside and really maintaining that tension can be, it obviously depends on the patient, but it can be detrimental to the pelvic floor as well, because if you're constantly creating that tension and not allowing for that relaxation phase, there could be residual tightness just sort of being held there, and soon enough the muscle could almost become a little bit weaker. So it almost could be, so we don't know if it would help or not. It obviously depends on what she's working on in particular. So it's very individualized.
And then, sort of as a side note, we're also talking about, what's the word? I'm trying to think of this word here. What's the word I'm looking for? The only word I'm thinking of is sanitary. I mean, it's something that if you're not taking care of it, could cause even more problems down the line. So that's just as a side note, if somebody rushes out and buys one of these things to help them. So
Exactly. I always tell my patients that, it's not a quick fix. It's one of those things that it takes time, and it takes focus, and it just takes, what's the word? See, I'm losing words now.
it's infectious.
But it's just important for us to sort of become one with our pelvic floor. If that sounds, I don't know if that sounds too dramatic, but but it really is important for us to take that time and work on our pelvic floor exercises per se, not just sort of rush through the day and rush through them as well, right? They need time.
Yep, time's a good healer.
Yep.
Yeah. So if we can sort of go full circle back to where you started with low back pain related to pelvic floor. So I think that that's something that maybe, if people have been lost through some of this discussion, they might be able to identify more with, because a lot of, we're very familiar now with the role of our core muscles in preventing low back pain. But I think it's not as well known, especially for women as we age, how important the pelvic floor is for that as well. Can you explain how that works? Because I didn't find it very intuitive at all myself.
I wouldn't have put those two together either.
Yeah. Of course, definitely. So one thing is that the core is not one single thing. So again, it's a group of different muscles. So we have our pelvic floor muscles, we have our rectus abdominis, which is kind of like our six pack, quote unquote.
I got one of those.
We have our multifidus muscle. So that is the little tiny muscles sort of that surround our spine. And we also have our diaphragm. So something that we incorporate almost every session in our pelvic health physio is the importance of breathing. So the diaphragm is a huge component to our core. So coming back to Shauna's question in regards to low back pain, in terms of our low back, our core, so those muscles that I just spoke of, sort of almost create almost like a corset around our thorax and around our midsection. So what essentially that does is that helps support our low back. Now our low back is filled with muscles that are, our postural stabilizers. So they're sort of on quite a bit. And for what we do, our day-to-day lives, lots of walking, lots of sitting, things like that, those muscles need to be on completely to sort of ensure that good posture and not overwork other muscles. So with our core, we almost create that balance from front to back. And with low back pain, you can assume that probably those muscles in the low back have sort of overworked themselves too much, and they're saying, hey, I need a break. And then the core is just getting a little bit overwhelmed, and that might shut off as well. So that's where we have that concern. So what we usually do with in terms of low back pain, we really have to assess our pelvic floor, and we have to assess the other components of our core to see where the mismatch is and what's not being recruited, what's not being engaged, and sort of take an assessment, with that sort of approach. And that's something that I really took away from my courses that I've been taking in regards to pelvic floor physio, because it's amazing to be able to almost treat low back pain from the inside, because a lot of times it's the pelvic floor that is not engaging or not recruiting when we want it to. And in addition to that, in addition to assessing, doing a vaginal assessment, we also do a rectal assessment, because the great thing about a rectal assessment is that we can access some of those deep hip muscles and the deep pelvic floor muscles as well. So if there's any sort of tension or any muscle imbalance that's going on there, those are huge contributors to back pains. We have the piriformis, the obturator internus that we can access through there. So yeah, that's your connection with the pelvic floor and low back pain.
Yeah, and it reminds me of sort of another public service announcement, is that when you have lower back pain, your body is telling you something. It's not telling you to take ibuprofen or Tylenol. It's telling you that something is going on that needs to be looked at. And
You got it.
as we said before, it could very well be your pelvic floor that I didn't even consider. So that's really interesting. Now, another question popped in my head. I don't know why, but if you are a woman, perimenopause, menopause, or beyond, and you potentially have or have had some pelvic floor injury, does a more active sex life help or hinder? I thought somebody might be thinking the same question.
Somebody could potentially be thinking that. You're correct. I wouldn't say that there is any sort of detrimental effect to that. However, we do discuss these things in assessment. So we do discuss further into their sex life and into the way that intercourse sort of plays out. So whether they have, if it's aggressive, if it's painful, if it's even painful just on penetration and then afterwards it's okay, there's still something going on there, because we have our superficial and our deep layers. We have to kind of keep that in mind. So I don't think there's anything bad about obviously having an active sex life throughout, and it's not bad to not. But I think if we come back to sort of those effects of dryness and itchiness and sort of that constriction we're going to get in the tissues as we age, having an active sex life may essentially maintain that flexibility a little bit better. right? Now, again, as long as it's
I'm
not.
glad I asked the question.
There you go. Perfect. Yeah.
That's awesome. So I think we're going to.
Sorry, you were about to say though. You said something about you were about to go on to something else though, and I think I cut you off.
Was I? I don't know. I don't think so.
No? It was just basically all good. Have more.
All good.
Have more sex. It will be good for you.
Exactly. Yeah. So I think we're going to wrap it up soon because Nabila has some wonderful patients to treat today. But I just wanted, I was really excited to bring you on today to talk about this issue because I think this is something that we can be so proactive about before menopause. Mm-hmm. So before the estrogen drops, it's a lot easier to do this work and to assess and to get really great results so that the pelvic floor issues that can happen with menopause are easier to manage, and also that you have a good relationship with a pelvic physiotherapist so that you can get excellent care through that time. So the last thing I wanted to ask is if somebody is not in Toronto or local, how can they access a really good pelvic physiotherapist? And what do they need to look for in terms of credentials?
So in terms of getting access to a pelvic health physio, you can definitely talk to your family physician. They should be able to refer you, and actually pointing out that you were looking for a pelvic floor physiotherapist is very important because not all physiotherapists are specialized in pelvic floor rehab. And I wanted to mention, you can also go to pelvichealthsolutions.ca. They're a great website, a great resource. They actually have a directory there with pelvic health physios all across Ontario and outside of Ontario as well. So that would be a great opportunity for both healthcare professionals and patients to go to. And in terms of credentials, you want to ensure that they are certified through an organization such as Pelvic Health Solutions. That's one of our big organizations, and they've gone through the specialized training for pelvic health physiotherapy. And you can actually find out whether they have or not by going to the college website. So you can, if you are in Ontario, you can go to the College Physiotherapists of Ontario, and under when you search the specific physiotherapist, they should have their credentials there that they do treat pelvic floor. Yeah. Hope that helps.
We'll put all that in the show notes too, so people aren't furiously writing it down.
Definitely.
We'll have it at the bottom too.
Perfect.
Yeah.
Awesome. So yeah, we'll leave the links of where people can find you, Nabila, as well. She works at several different clinics right now. So there's lots of access. And I just wanted to thank you so much for coming on in this little short span of time. I was really excited to share this information. So thank you so much for joining us today.
No problem. Thank you for having me.
Yeah, I would definitely eye-opening. Thank you.
And thank you for your questions.
All right. So if you
some just pop into your head when in these podcasts.
You know, I know. Yeah.
We have questions, but sometimes they pop up.
They're always the good ones.
All right. So if you like our podcast, please download and follow. And we're also on YouTube now as well. So if you check out the Ultimate Perimenopause podcast, you can find us all over the internet. And thank you so much for joining us today. We look forward to seeing you next week.
Perfect. We'll see you soon.
Bye.
Bye.